Hello everybody and welcome back to my YouTube channel. Today we are talking about a condition that is a congenital condition known as Osteogenesis Imperfecta or brittle bone disease. This is something that you're born with, and many people do live to adulthood with this condition, but also many people do not. So we're just going to talk about this unusual condition and how it affects people. So let's get into it. Okay, so osteogenesis imperfecta is a congenital disease. It can be passed down, but it also is just a gene mutation, and there are many genes that they have identified that causes this, and it affects about 1 in every 15,000 people, which seems like a lot, doesn't it? Like, I guess you kind of think of it being a really, really rare, but I guess it's really not that rare anyway. So it can range from mild to severe, and your bones are very, very, very easily broken. That's the main issue, and then there are other issues stemming from that as well. So the issues are going to start off with growth issues. They could have loose joints. They could have muscle weakness. So this also causes very thin blood vessels, which is going to cause increased bruising. They could have hearing loss, either affected by the central nervous system or simply by the bones in the ear that no longer work properly because they are so brittle. So that can happen as well. You can have central nervous system changes related to the way the bones are deformed, like if it's pinching your spinal cord or whatever. And you can also have like intermittent abdominal pain, chronic constipation. Obviously, bone fractures, many bone fractures. You can also have dental issues, obviously, because the teeth are made of whatever. So the types 1 through 5 are known as autosomal dominant, and types 6 through 8, well, there's a 9th one that they're kind of still researching, are considered recessive. So it can be passed down if you and your partner both have one or the other. Genetics, it's a whole nother day. It's a whole nother topic. So type 1 is the least severe. It is the most mild one of them all. And then type 2 is the most severe. If you watched Grey's Anatomy, you'll remember that Jackson and April, their first baby, had osteogenesis imperfecta type 2. And this is a common complication of type 2. They pretty much just are breaking all of their bones inside the mother's uterus, and the delivery process even breaks even more bones, and they just don't survive. It sounds literally horrible.
Type 2, we're dealing with low birth weight, underdeveloped lungs, swallowing problems, respiratory problems. If carried to term, type 2 infants typically die within a few hours of delivery, sometimes days. Your baby's also at high risk for intrauterine fracturing.
So basically, these are all kind of broke down to a collagen issue, whether there's too little, poor quality, things of that nature, and then the different genes that are affected. It's all very scientific. So often it's discovered when the patient has like multiple fractures and like many different stages of healing. So if a child comes into your emergency room and they have multiple fractures and many different stages of healing, you're going to be side-eyeing those parents like, what are you doing? So oftentimes it can be confused as child abuse initially, but then there's more testing that is done, and then they find out what's really going on. So how do you treat this disease? There's no cure. There's really no treatment. It's not like, oh, drink more milk. Thanks. As far as surgical treatments, they can spinal fusion to correct any scoliosis or any pinching. And they've also started inserting rods into the long bones to strengthen them and to keep them straight, because the deformities, I'll show you pictures, the deformities are significant. The rods were pioneered by Shriners Children's Hospital in Chicago, actually in the 40s. So that's really interesting. And so they worked with many patients with osteogenesis imperfecta and tried to work with what they could do to increase their mobility and increase their muscle strength and everything. So the rods gave them some more stability to where they could better perform in physical therapy and hydrotherapy and gain their strength back. A lot of patients have to use accessories to get around, such as a wheelchair or even crutches or splints, things like that. So it's not a cure-all, these rods, unfortunately, but it will greatly increase the patient's mobility depending on their severity. And another fun fact is that dogs can have this disease as well. There's many dog breeds that can develop this with the gene mutation or inherently passed down as well, so that's really interesting and really, really sad. It's all kind of sad, isn't it? Alright everybody, thank you so much for watching. I hope you really enjoyed it. I really enjoyed making it. I really enjoyed making these videos. They're just so interesting and out there, and I would never learn about this other than just doing my own research and making these videos. So I hope that you guys enjoyed it. Comment down below if you've ever seen this before in your practice. Like and subscribe, and I will see you guys in the next one. Bye.